Hello, and welcome back to the Wellness Edit, where we explore natural mental health and holistic wellness. I'm Dr. Donna, and today we're diving into a topic that brings both science and wellness together in a very powerful way. Joining us today is Christina Veselak, a licensed psychotherapist and a certified nutritionist with more than 30 years of experience supporting mental health through nutrition-based approaches. Christina, welcome, and we're so glad you're here. Would you like to give us a little introduction about yourself?
Yes. Hi, Donna. Thank you so much for having me on this show. I really appreciate it. I love talking about this topic and amino acid therapy and how we can all support our brain health ourselves using lifestyle choices and especially food. So that's what we'll be focusing on. I've been a licensed psychotherapist working in the addiction field as well as the general mental health field for 40 years. And after about 10 years, I got introduced to amino acid therapy by Julia Ross, who wrote the book The Mood Cure, which is sort of the Bible of amino acid therapy.
We should have
And
her on the show too.
oh, have you? Wonderful. And I realized then how dramatically nutrition matters to mental health and addiction recovery. And once I started getting myself fully trained and integrating it into my practice, everything changed. And frankly, people's lives started getting saved.
That's amazing. That's just absolutely amazing. For our listeners who may be new to this topic, tell me what is amino acid therapy, number one, and number two, how in the heck does it relate to mental health?
Great question. So brain is made up of physical matter, right? Our brain is a physical organ. It weighs about 3 pounds. And it's literally made up of the things we eat that form both the structure of the brain and the function of the brain. Well, and so we have to be getting those nutrients in, pretty much every day so that the brain can function optimally. It's our brain's job to allow us to cope with stress optimally, but to do that, it must be fed optimally. Our mood and behavior are mediated through chemical families in the brain called neurotransmitters. And there are 4 big neurotransmitter families that specifically mediate mood. We have serotonin, we've got the catecholamines that include dopamine and adrenaline. That includes GABA and the endorphins. They all do different things, and maybe we can talk about what they do a little bit. But they are specifically made from amino acids, which are these tiny molecules that, when bound together, make protein. And so when we eat protein, whether it be nuts and beans or fish and chicken, I just finished sardines for breakfast today. We get a whole bunch of different amino acids. And when we digest our protein, and we need to be able to digest it well, it's what we need our hydrochloric acid for, it turns into these little amino acids that go all through the body, doing everything. They make our skin, they make our muscle, they make our blood cells, they make our enzymes, they even make our DNA. And some of them cross the blood-brain barrier, get into the brain, and in the presence of vitamins and minerals that we also need to get from our food or supplements, they make neurotransmitters.
It's so interesting. So tell us a little bit more about why this is so relevant to mental health.
Well, because if our neurotransmitters are working well, we are working well. We can have a good, stable mood. We can have energy, focus, drive. We can sleep well, we can relax, we can focus, we can do all these things that we need to thrive in life. However, if these neurotransmitters are low and are out of balance with each other, and this can happen for a whole bunch of reasons, but the foundational reason is that we're not getting the right nutrients in our food, we are out of balance. So if the catecholamines are low, we may be tired and depressed and not have any motivation or drive, and we can't step up and cope, and we just want to, hide under our beds.
Yeah.
If serotonin is low, we're anxious and we're agitated and we're worried and we're, obsessively thinking about this, that, and the other, and is everything going to be okay? Okay? Or we may be really perfectionistic and really controlling and rigid, and everything has to be just right. Okay? And if serotonin is low, we're not going to sleep. We're going to be worried. We're going to be ruminating. And serotonin turns into melatonin, and melatonin tells us that it's time to go to sleep. So
That's
if we don't have enough serotonin, we're not going to have enough melatonin.
wow.
All right.
Excellent.
And then GABA is our foot on the brake. GABA slows everything down, calms, smooths everything out. If GABA is low, we may have a seizure disorder or essential tremor, or we're like overwhelmed, like everything's coming in all at once and we don't have a filtering system. So GABA is our filtering system. It filters out stimulus, loud noises, bright lights, scratchy clothes, too many distractions. So having enough GABA allows us to flow with stress and get done what we have to get done without going frantic. Okay?
That's really good.
The endorphins are our emotional and physical pain relievers. So if we don't have enough endorphins, we're going to feel physical pain really acutely, and we're going to feel emotional pain really acutely. So we might get stuck in grief or get stuck in loneliness, or, well, self-hatred is more low serotonin, but we're just going to need comfort. So if any of these neurotransmitters are low, Donna, we're going to seek relief. And many of us will seek relief by turning to something that maybe we shouldn't, or maybe we shouldn't just a little bit, but not too much, right?
Right.
So we may reach for sugar, or, those beautiful donuts.
Yeah.
Or alcohol, or in today's world, THC, cannabis, right?
Right.
Those little THC gummies before bed that actually have been sending people to the hospital with, GI distress, or, our oxycodone runs out and we want more of it, right? Or we can't let go of our benzos, or, right? We're reaching for relief, and
Right.
that relief can take on a life of its own and become addictive.
Yeah. That's excellent information. So we know that traditional mental health is usually about talk therapy and sometimes medication, things like that. So how does this approach differ from the traditional approach?
Well, I am not anti-medication. I just believe in feeding the brain first. Okay. I want to be feeding the brain what it needs to function optimally. And very often people don't need any more medication if they are using both the right types of food and the right amino acids. It rebuilds neurotransmitter systems. And then we can actually engage in psychotherapy more effectively. Because if our brain is working, then therapy is going to work.
Yeah, I share that opinion. That's well said. Well said.
I actually feed my clients in session if they come in with a starving brain.
That's awesome. Okay, so you've already talked a lot about this, how amino acids can influence mood, stress levels, and overall mental well-being. Did you want to add anything to that?
Well, would you like me to discuss some of the individual amino acids that people can buy over the counter?
Sure, we can do a few there. I think we have time for that.
Okay, so tyrosine. And for years and years and years, I was on tyrosine because my catecholamines were really low. I had a slow, sluggish depression, and I had ADHD. And I found that by taking tyrosine, and actually I needed quite a bit of it, not everybody needs this much, but I did. I needed 3 grams of tyrosine per day to give me brightness and energy and get up and go and help my brain go in a straighter line. And all amino acids, and this is what makes them a game changer, Donna. Amino acids work getting to the brain and start rebuilding your neurotransmitters within 20 minutes. Within 20 minutes.
That's amazing.
Now, medication, you have to wait weeks and weeks usually. With aminos, you wait 10 to 20 minutes. And if you didn't quite get the dose right, then you can raise the dose until you get the effect you want.
Yeah.
Occasionally we have adverse responses, but generally that's because our dose is too high. So if we're not getting the effect we want, we dose higher. If we're getting some unwanted effects, we dose lower. Very flexible. And this empowers the ordinary person, Donna, to take care of their mental health themselves. Now, of course, I train coaches. So if anybody wants help, they can reach out to me or my coaches to walk through this, but it's actually a very simple process. So that's tyrosine. One of my most favorite amino acids is theanine. So theanine does a number of different things. It supports GABA, but it also supports dopamine and serotonin. And it partially blocks our stress hormones. So theanine gives us a smooth, calm alertness, and it reduces stress. It helps your brain go in a straighter line. If any of your listeners, Donna, have ADHD, which I have, and experience where you've got too much coming in all at once and you start spinning, and then your anxiety goes up and you kind of start panicking because you don't even know where to start and it feels so overwhelming. And then we just freeze. We just freeze and run away and procrastinate and do something else. Theanine stops that process.
Amazing.
100 milligrams. Some people need 200 at a time. Very few side effects. And it really just helps your brain get done what needs to get done.
That's amazing. This is such great information. Christina, what are some common signs that somebody might benefit from nutritional support for their mental health?
Their therapist tells them that they need to go on medication. We have found that the most people who are on the most medications, like 3 to 5 to 10 to 12 even, are the people who are eating the worst, who are living on ultra-processed foods. And if you're not getting any nutrients in your diet, then even the medications aren't going to work. And the doctors just keep piling them on rather than telling you to feed your brain. So if you have symptoms, if you're depressed or anxious or can't sleep, or you're just really, you don't care anymore, or you're just really stuck in this intense emotional or physical pain, these are signs that amino acids may be very wonderful allies. And what's amazing about aminos, Donna, is that they're anti-addictive.
Yay. Right. Yeah. Can you also give amino acids to children in appropriate doses?
You sure can. And in fact, there's some doctors who've been giving aminos to children as young as the age of 2. And again, you want to dose down.
Right.
But then as they get older, you want to dose up, and very effective. And most people don't need to be on aminos forever. I needed to be on them for a really long time because I had a lot going on and I had a torn up gut from celiac disease. And so it took me a long, long time to repair everything so that my brain could manage itself.
Yeah.
And then I got there. And now I don't need aminos at all other than just, sort of spot check or something a little bit before bed.
Pretty amazing stuff. So, Christina, what role does nutrition play in supporting mental health on a daily basis? Like we've just touched on that a little bit, but on a daily basis, what can improved nutrition do for us?
Keep our mood and energy balanced. So, we've talked a little bit about food and amino acids to rebuild neurotransmitters, but the other side of this, Donna, is to keep blood sugar absolutely stable. And because if blood sugar drops because we've gone too long without food or we ate a high sugar meal and our sugar went up and then our sugar crashes, adrenaline kicks in. And adrenaline does nasty things for us. Adrenaline can make some people irritable and aggressive all the way to full-blown violence. Adrenaline can give other people panic attacks. I've got stories about these if you want to hear any of them. But adrenaline destabilizes us. And for somebody in recovery from addictive behavior, this adrenaline from low blood sugar actually creates a craving for our drug or behavior of choice, as it were. And we lose access to our recovery skills because when under the influence of adrenaline, we've got the amygdala activated and the brainstem activated, and this part of our brain goes to sleep. It goes on vacation. And so we lose access to our stress management skills, our relaxation skills, our communication skills.
Yeah.
And all sorts of bad things can happen.
I have to think a lot of this is going on in our schools too with our children.
And maybe even the teachers.
Absolutely. Everybody's so stressed out in so
we
many
recommend, and I actually wrote my book, Eat to talk about this, we recommend eating 15 to 20 grams of protein minimum every 4 hours. Premenstrual women often need to be eating every 3 hours. Some people can go longer, but most people with mood or behavioral issues really need to be getting that protein in every 4 hours during the day, very, very regularly. We do not recommend intermittent fasting for people with mood or behavioral issues.
Excellent. Okay, so let's move on to addiction recovery and detoxing as well. And what role does amino acid therapies play in the body, both when people are coming off the drugs, and so they might be in withdrawal, and then in early recovery when we want to stabilize people's moods too.
So post-acute withdrawal, which is what people experience after active withdrawal. I'll get back to active withdrawal in a minute. Post-acute withdrawal, which can last up to a year or more after sobriety, abstinence from, any substance or addictive behavior, includes depression, anxiety, insomnia, agitation, aggressiveness. And it's due to two things. It's due to depleted neurotransmitters and low blood sugar. A lot of people switch addiction to sugar in early recovery because they have a starving brain and their brain needs something and sugar's there, right? But of course, with sugar, we're doing this all day. So post-acute withdrawal due to depleted neurotransmitters and reactive hypoglycemia can be easily managed by getting that protein along with other real food in every 4 hours and using specific amino acids to rebuild those neurotransmitter systems. Because, everybody's heard of tolerance, where you need more and more and more drug to get the same effect.
Right.
A lot of people don't understand the science behind that. And what it is, you ever used an ATM card, Donna, and stuck it in the ATM machine and pulled out money? It's really nice. But have you ever used your ATM card and there's no money in the bank?
Right.
And you kind of overdraw, right? So this is what addictive substances and behaviors are like. Every time you use an addictive substance, you are drawing money out of your bank. You are firing a neurotransmitter. You're getting the effect you want temporarily, but temporarily it also depletes your store of neurotransmitters. And the brain has to make more. Well, like with our bank, it's fine to pull money out just as long as you're putting money in. But the more people get involved in addictive behavior, the less money they're putting into their bank, the less self-care behaviors they're engaging in, the less good, healthy food that rebuilds the neurotransmitter systems they're eating. And yet they're still using the drug. And finally, the brain says, oh my goodness, I'm firing way too much neurotransmitter. I need to make less, and there's not enough raw material around anymore. And so it's going to take me longer and longer to make more. So the brain is down regulating. What that means is that you need more and more drug to get the same effect.
Correct. Yeah.
And then more, and we move from early to middle to late stage addiction. Well, in early stage addiction, if you stop using, your neurotransmitters are not that depleted, and you can probably get by without a whole lot of problems. However, in middle or late stage addiction, your neurotransmitters are really fried. They're really depleted. And you stop using that drug, and kind of like all hell breaks loose in your brain, because it reaches for a neurotransmitter and it's not there. And so we can get very serious and sometimes even life-threatening in the case of abruptly coming off alcohol or benzodiazepines, life-threatening effects, but it's going to be really, really uncomfortable. Well, bringing in amino acids, either IV or orally, since they work within 20 minutes, can give the brain the raw material to make their neurotransmitters, immediately raise those neurotransmitter levels, and significantly reduce the amount of withdrawal symptoms and cravings people are going to have.
Yeah, and then moods are going to be more stable at that point too.
Moods are stable, energy stable, withdrawal symptoms are dramatically decreased. I just helped somebody who was severely addicted to both kratom and a kratom derivative called 7-OH, which you can actually buy at gas stations and head shop type places. And it's really quite a dangerous drug. Even they say up to 50 times more addictive than heroin. And he was dreading his withdrawal. He knew he had to stop, and he'd been through it before, and it had been excruciatingly horrible. So he was dreading it. And I gave him a protocol to follow, and he followed it absolutely perfectly. And I checked in with him every day. And he's now a month out, 6 weeks out. He's totally back to normal. He has no cravings. He's okay. It took him just about 5 days to get through it, but he said that it was less than half as bad as he thought it would be.
That's pretty amazing.
Less than half as bad. He basically sailed through. Okay.
Yeah.
He was uncomfortable. Well, we can handle uncomfortable, right? It's
Easier than the other.
excruciatingly horrible that we sort of want to avoid.
Excellent. So, Christina, why do you think all this is overlooked in traditional recovery programs?
I think there's several reasons. There has not been money put into researching amino acid therapy for addiction treatment. We actually went to SAMHSA several years ago and asked for money, and we were told point blank that all the money was going to pharmaceutical research, and there wasn't going to be any money for nutritional research for addiction recovery. We were told this point blank, right? And then we talk about amino acids to treatment providers, and they say, well, where's the research? Is it evidence-based? And we say, well, there is research, there is evidence, some of it's old, and we can't get money to do more. Right. So that's a huge problem. Physicians are not taught about this. You know, students coming out of my training program, Donna, know more about how to feed the brain optimally than psychiatrists do.
Absolutely.
Their toolbox is tiny. Their toolbox is just medication. Our toolbox is huge and works so much faster and more effectively without side effects than medication does. But nobody's being taught this. The medical schools aren't teaching this. And even the new food is medicine movement, which is wonderful, and I endorse it and I'm excited by it, they've never once mentioned mental health or addiction recovery. Not once.
We know that our body is, our minds, our feelings, our thinking, our behavior is so interconnected to our physiological processes in our body. And we are learning more and more about that every day. So, but I understand that pretty soon the American Psychological Association is going to be offering some of your continuing education courses. Is that correct?
Well, it sure is. So, I run this school called the Academy for Addiction and Mental Health Nutrition, where I certify people as amino acid experts in amino acid therapy and nutrient therapy. And I run a nonprofit called Eating Protein Saves Lives, where people can get information about how to integrate food into your diet. But recently, the American Psychological Association hired me to put together a 20-hour, what they call a mini certification program, and it should be launched sometime in May, to train psychologists in this approach. And it's very exciting. And you won't get the coaching that you do in my training program, but you'll get most of my core material if you want to get CEs through the American Psychological Association.
So this is going to help with some states who maybe don't offer this currently, perhaps providing a venue to start legitimizing this, and so that we can offer it as mental health professionals, and we can team up with other health professionals if we want to go the IV route. And it's just nothing short of miraculous, in my opinion.
Exactly. It really is. And I'm very excited about this APA opportunity because finally psychologists who are never taught this in school will have a chance to learn the foundations of nutritional psychology and psychiatry.
Yeah, that is just tremendous, because as therapists, we can be so much more effective when we help the people that we're trying to help when they become healthier in their mind and their other parts of their body. If you're feeding your mind, you're also feeding the rest of your body too. Nice, healthy
You sure
foods.
are. You sure are.
Yeah. So I have just loved having you on my show, and I hope you come back again. It's been a really insightful conversation, and I want to thank you so much for sharing your knowledge and helping us to better understand how nutrition plays such a pivotal role in mental health. So, how do we get in contact with you?
Well, you're welcome to pick up your phone and call me. My number is 303-888-9617, or you can go to my website from my school, which is aminoacidtherapy.com, and check out my courses and my blogs. My nonprofit is eatingproteinSavesLives.org. And then to get a copy of my book, you can either go to Amazon, or you can and just put in "eat" with my name, or you can go to the book's website and I will mail you a copy personally because I have books sitting in my garage. And that website is Eat for Recovery.
Thank you so much. And I urge our listeners to learn more about this so we can all live healthier and happier. Thank you so much.
Thank you, Donna.